Good morning, everyone. Thank you for joining us. Very happy to be here today with Matthew Bauer. So Matthew will be coming out later this year in May. So we've got him coming out on Saturday, the 17th of May to Sunday, the 18th of May for a 2-day workshop where he'll be teaching us some treatments for peripheral neuropathy as well as geriatric treatments. And that's what the presentation today is going to be on as well. A little bit of a introduction to how Matthew got into that and how it's changed his practice and everything. So just a little bit of an introduction for Matthew. Um, uh, Matthew's been in practice since 1986, practicing out of a small community in Southern California. And there he's sort of developed this bit of a specialization in treating peripheral neuropathy and geriatric conditions. But he's also studied with a 74th generation Taoist master for 10 years as well. So very much steeped in the traditions of Chinese medicine and Taoism. He's also a big part of the Acupuncture Now Foundation, and as part of that, he's started a peripheral neuropathy campaign to get the public more aware of acupuncture as a great treatment option for peripheral neuropathy using like the current evidence and research. He's also taught on practice management through Making Acupuncture Pay, and I think he'll give us a little rundown. That's recently been republished and is available or will be available, but I'll let Matthew talk a little bit more about that. So that's a little bit of a rundown. I'll post a link to our, if you're interested in joining us for the event in May, I'll post a link to the information there so you can check that out and join us if you like. Otherwise, I'll hand it over to Matthew for now.
Yes, I'm so very thrilled to be here on the other side of the world with you guys, and happy Tuesday morning. It's Monday afternoon for me here in Southern California, and so I pretty much fell into a specialty of treating geriatrics, and we'll talk all about that. And in a way, the same thing with peripheral neuropathy. So in this talk today, we're going to cover some of the main points we'll be covering is, number one, how I became interested in treating older adults. What I learned after treating many older adults that surprised me the most, and then how I became interested in treating peripheral neuropathy, and then what I learned about the research behind peripheral neuropathy that surprised me the most. And then also my point of view about how a focus on geriatrics can help build and sustain an acupuncture practice. So a quote that I've heard from so many of my patients over the years is that the golden years ain't so golden. So people do run into problems as they get older, and that's part of what I've not only been practicing so long with, but kind of cut my teeth on from the early years. I opened my practice in January 1986, as soon as I could after graduating from acupuncture college. I was supposed to have a partner working with me, but just before we opened, she let me know that her husband had told her that he thought it was too big of a financial risk. So I had already signed a lease to open this office, and now the financial risk was going to be all mine. Now, my wife had just given birth to our second son, and she wanted to be a stay-at-home mom for as long as she could before having to go back to work to help support the family. So it was just like, hey, let's give this a try and see what happens. I was now the sole source of support for a family of 4, trying to survive off a brand new acupuncture practice with 0 patients. My office was quite small, about 400 square foot or 37 square meters. We had two treatment tables that I had actually built myself, and they were separated by sliding curtains that my wife had sewn together and fashioned together. So very humble practice. We'd also moved to a new city in an area east of Los Angeles that neither of us had lived in before, a city called San Dimas. Its primary claim to fame, which happened a few years after we moved there, was being the supposed setting for the Bill and Ted's Excellent Adventure movies. They were always talking about San Dimas High or going to the San Dimas Mall, which there was no San Dimas Mall. But before those movies came out, about the only thing of any note of San Dimas was that they had an annual Western fair. And so it was a very conservative community. What I was unaware of, not being from this area, was that San Dimas was surrounded by several elder care facilities. I came to realize that when some of the first handful of patients that came to my practice were primarily women in their 70s and 80s from these care facilities. Now, I had a very limited experience in my school training in treating geriatric patients, and there were no textbooks for acupuncture geriatrics at that time. And I think that might even still be true. I know 10 years ago, I was approached by a publisher of TCM books asking if I would write a textbook on geriatrics. And we kind of started the project, but things happened to the project fell through. And I don't know if anybody has come out with a book on geriatrics since then. So there wasn't anything I could learn from any kind of book. Now, the first of these older patients I started to see were in pretty bad shape, and they were desperate enough to try this young, non-Asian acupuncturist out and see if I could help them. Some told me, which you may have heard, I'm sure most acupuncturists have heard at some point, but I heard this quite a bit, especially in the early days, that I was their last hope. And I was somewhat skeptical about how effective the treatments would be for this patient demographic because I assumed that because they were older with depleted qi reserves and with many complex health issues, that they would probably not respond very well, certainly not be cured. However, what I found was that, and this was the surprising part, that while hopes for a cure were not realistic, I was surprised to learn that for most of the patients in this demographic, even the slightest bit of improvement made a big difference in their quality of life and functioning capability. In other words, a little improvement went a long way. On top of that, these patients were very grateful for any improvement. They were so grateful, in fact, that they were happy to tell others about their experience with this new acupuncturist in town. And this is what pretty much saved me, helped to build my practice and probably saved me from going out of business. Those first desperate older patients spread the word in the care facilities they lived in. And most of those facilities have programs, all sorts of activities and programs for these residents where they encourage, community building and friendships and everything. They tend to be very close-knit communities. And when someone is observed finally getting relief for a health issue that no other doctor or therapist could help them for, their fellow residents notice this, and even so did their family, and even other caregivers. So the word spread. During my first couple years, patients in their 70s, 80s, and 90s made up about 70% of my patient base. And a good portion of the other 30% were younger relatives or friends of those older patients who were impressed by the help that they'd received. Some were also younger caregivers in those elder care facilities. And while most initially were female, I also started to see some older male patients as well. Most of the first wave of these patients were in pain, especially with issues like osteoarthritis and advanced osteoarthritis of the lower back, the neck, the knees, the shoulders. I also saw compression fractures and things like urinary incontinence. And eventually, I started to see things like macular degeneration, Parkinson's, various types of cancer, and rheumatoid arthritis. I can hardly begin to tell you what a great experience this was for me. Even today, as I was preparing for this talk and then for the workshops I'll be doing later for China Books in Sydney, it struck me how fortunate I was to have had this experience shape my early years of learning how to practice this medicine. You know, when treating geriatric patients, you tend to find, and this, don't take this wrong, but you tend to find lower expectations. And few in this patient demographic expect a cure. And again, every little bit of improvement means a great deal to them. Inexperienced acupuncturists need to be careful, I believe, about biting off more than they can chew. It can be very stressful. My teacher had warned me about against taking very serious cases, early on in my career. However, what happened to me in starting my practice was really a gift from the heavens. It wasn't some smart planning on my part that that led me into this situation where I could refine my skills in this medicine and build a steady practice focused on this type of patient base. I didn't move to San Dimas because there were a lot of elder care facilities there. We actually moved there because we lived in a pretty rough town. And my wife told me that our son was not going to be born in that town. So we actually started driving around in ever increasing circles around our town, looking for a hospital where we thought we'd want to have our son. And we found a really quaint, nice community hospital in San Dimas. And that's why we decided to move there to have our baby. And then it was like, well, if we're going to have our baby here, we should move out here and I should look for a practice here. And that's how I ended up in that town. Now, during this time, I also began to start seeing peripheral neuropathy patients. And I'm sure most of you are familiar with the term, the condition peripheral neuropathy, but let me take a moment just to, define the type of peripheral neuropathy I'll be talking about here, because there are over 100 different types of peripheral neuropathy. But the main type can be really lumped into four main categories, and that is diabetic-induced peripheral neuropathy, or PN, chemotherapy-induced PN, idiopathic PN, meaning of unknown cause, and then the PN that's associated with HIV/AIDS. While I did see some AIDS patients, not HIV/AIDS neuropathy patients in my early years. I did see quite a few neuropathy, especially the diabetic and the idiopathic types in my early practice. Now, out of these four, the most common is diabetic-induced peripheral neuropathy, often designated as DIPN or just DPN. Some 50% of diabetics 65 years of older develop this PN. Now, the second most common, at around 25 to 30% of all these four types, is often undiagnosed and overlooked, and that is the idiopathic or unknown type. This type is most common in people over 70 years of age, and so it's often seen in geriatric practices. The third is the chemotherapy-induced PN, designated as CIPN or just CPN. And CIPN is the second most common side effect to chemotherapy, next to nausea. And it occurs at a rate of 68% within the first month, 60% within the third month, and 30% by the 6th month of chemo. The PN associated with HIV/AIDS is the fourth of these four, and it has been on the rise with the development of the antiretroviral combination cocktail therapy that has been so significant in increasing HIV or increasing AIDS survival rates. Because this type of peripheral neuropathy mostly impacts the feet and lower legs, and then the fingers to the hands and wrist, it is often called stocking and glove neuropathy. All these types of neuropathies share another important aspect, and that is the symptoms that they cause. Numbness, pain, tingling, burning, loss of fine motor skill, loss of balance. All of these symptoms are caused by damage to peripheral nerves, and especially sensory peripheral nerves. And this nerve damage has long been believed to be irreversible. However, what is important to those of us practicing acupuncture is the impressive body of research that has found that acupuncture can improve the nerve damage seen in PN. In other words, acupuncture actually has the potential to reverse what is considered to be this irreversible nerve damage. And we'll consider some of that in just a bit. Now, my very first PN patient was my father, seen here holding our oldest son. He had diabetic PN, and I did a series of treatments on my father while I was still a student in my acupuncture college. Many PN patients develop numbness and this inability to feel pain, pressure, or temperatures. In fact, numbness is the most common symptom in peripheral neuropathy. This numbness is responsible for a loss of balance in PN patients that in turn is responsible for the high rate of falls and the injuries from falls PN patients suffer. The numbness is also a major factor in diabetic ulcers that can lead to even becoming gangrenous and lead to foot or limb amputation. The quite remarkable thing about acupuncture is that it has the ability to stimulate the nerve damage that leads to many symptoms seen in PN. Now, in my father's case, and pardon me here because I think I missed a slide or something on my notes, but in my father's case, he had this very severe numbness, actually the worst I've ever seen, even after 40 years of practice now and seeing hundreds of cases. But what I saw with my father was after several treatments, he began to feel the needles just below his knees. And then after more treatments, just going down his leg, he began to feel a little bit more and a little bit more and a little bit more. And here's a short clip I want to play for you of a 92-year-old peripheral neuropathy patient I was treating recently at an elder care facility, as she relates to me what she was experiencing after just 2 treatments. And we tested the sound, so I hope the sound is okay here for you folks. This third treatment. Now, you had also mentioned to me that you felt some things were feeling somewhat different with the legs. Could you explain that again?
Yeah, it's almost like prior to the puncture, when things were really have a sensation of a feeling in there. I know the nerves becoming alive, so look like tiny little fingers are in there.
Now, when this patient said that her feet had been feeling dead and were now starting to come alive, and I hope you heard that, this is something that I've seen many, many times, beginning with my father. Because so many PN patients have this numbness due to nerve damage, and you can see this start to reverse with acupuncture, that's a very big deal, because this nerve damage, again, is believed to be irreversible. Now, again, with my father, he couldn't feel any needles, even bigger, we were using 28 gauge needles back then, was the common size that we used. And even doing the most sensitive points like kidney 1 and using a strong stimulation technique, and me being a student with no needling skills, he felt nothing at all. But gradually, again, he started to feel going down his leg a little more and a little more, a little further down. And then one day he called me and he told me that he thought the treatments were working because the night before, when he was up getting a late night snack, which he shouldn't have been doing as a diabetic, he could feel the cold of the tile under his feet for the first time in years. Now, there can be some differences between different PN cases, but the most common pattern that we see in this disease onset, especially in diabetic PN and idiopathic PN, is that the numbness starts at the feet, either in the toes or the balls of the feet is what you'll hear the most. And then it gradually works its way up the leg to usually just below the knees, the stocking area. And what I saw with my father, gradually getting the feeling back, I saw many times again over the years. He started to feel below his knees and then gradually down to his feet. In other words, the reverse onset of the start of the symptoms starts in the feet and works up its leg. And very often when we start to help those nerves come back, it starts in the upper part of the lower leg below the knee and works its way down to the feet. It's just a beautiful thing to watch this reversal, which, by the way, happens in other conditions, not just peripheral neuropathy. Some of you have probably seen this, that the first thing that is the first sign of a problem is often the last thing to get better, and the last thing to come out of that problem, the branch of it, is often the first thing to get better. One of the things I learned by trial and error in treating my father, and then I was able to refine over the decades, and that was how to monitor the degree of sensitivity these patients with numbness have to the acupuncture needles. Now, not all PN patients will have hyposensitivity, but many of them will. And you should learn how to monitor this degree of sensitivity. What you are looking for is the degree of sensitivity returning into the more normal range. This will happen as the nerves are being regenerated. You should learn how to watch for, monitor, and manage this change in needle sensitivity. It's an important part of the protocol I developed over the years. This is like doing an acupuncturist's own version of a nerve conduction test. I'll be teaching how to do that in my workshop. The other thing, and I didn't have it in my notes here, but some of you may ask this question is, yes, actually sometimes there can be hypersensitivity, and even more specifically, a degree of both hypo and hypersensitivity. With the hypersensitivity, we should see it come down somewhat more into normal range. But by far the more common is the hyposensitivity that we should see come up to normal range. Monitoring the degree of needle sensitivity in this way can prove pivotal in any individual patient's management, because sometimes the needle sensitivity will happen before the patient feels any improvement in their symptoms. So when you see this normalizing in the needle sensitivity, you can tell your patients with confidence, if they just stay with the treatment, they will start to feel better. And that's why it's important to make sure the patient is aware of their level of abnormal sensitivity, especially this hyposensitivity. So when they start to feel the needles more normally again, you can point out to them, remember, you could not feel that before, or you couldn't feel it so strongly as you're doing now. That's something that helps people realize something is happening here. And for any individual case, that may mean the difference in the patient staying with the treatment long enough to actually experience the relief of the symptoms, or maybe stopping the treatment because they're not seeing improvement. Now, over the decades since I opened my practice, I began to see more younger patients, including children, even infants. So while my percentage of my younger patients to my geriatric patients has shifted somewhat over the years, I still have a pretty good 40% or so of my patient load is from geriatric patients. And since I've definitely grown from what it was in the earlier days as far as the number of patients I see in a day or a week, I've been seeing up to 20 plus patients a day now. I still see a good number of geriatric patients. Now, the one thing I wanted to share with you is that one thing that distinguishes chemotherapy-induced PN from the diabetic and idiopathic types is that, as I mentioned, in diabetic and idiopathic, the symptoms start in the feet and then work their way up to the knees. And most idiopathic types, idiopathic PN types, don't get it into their hands. With the diabetic types, they may eventually get it into their hands. But what's different about chemotherapy-induced PN is that they can get into their hands as soon as their feet from the very beginning of the chemotherapy. So it definitely comes on stronger, and there is a different kind of etiology as far as how it ends up getting damaged. But the nerve damage itself, and this is something that we won't have time to go into that much detail here, but the nerve damage itself, whether it's from chemotherapy drugs or blood sugars or HIV/AIDS or the drugs from HIV/AIDS, or whether unknown reason with idiopathic, the nerve damage tends to be the same. And so the treatment can be the same for all of these different types. But I had trouble with getting good results with chemotherapy in the hands. And then I started to actually get more and more of these patients referred to me through a pain management system in some local pain management hospital clinics. And so it took me a while, but I got better at my point protocol for treating peripheral neuropathy in the hands. And when I got to the point where I felt like, hey, now I feel like I've got to have a pretty good handle on how to treat these chemo patients for their hand neuropathy, that's really when I decided to put together a course, a training on acupuncture for PN in early 2023. So while I was putting this course together for my PN protocol, I decided to do like a quick review of the research on acupuncture for PN. And when I looked into this research, I was really surprised, kind of shocked really, at what I saw there. An amazing combination of factors that really got me very interested. I found that dozens and dozens of studies have been done with acupuncture for peripheral neuropathy, the vast majority of them with positive outcomes. The deeper I dug, the more I realized that there was a kind of, this research represented a unique combination of findings, a kind of perfect storm that I've never seen in any other body of research on acupuncture. That's when the idea of launching a campaign with the not-for-profit Acupuncture Now Foundation was born. And so let me just quickly explain what those factors that I found. First is the body of evidence utilizing before and after nerve conduction tests that demonstrate that acupuncture routinely causes measurable improvement in nerve conduction. Now, this strongly suggests that acupuncture is sparking regeneration of these damaged nerves. Now, again, in my practice, I had been seeing acupuncture cause regeneration of damaged nerves since I treated my father over 40 years ago, but I had no idea that there was actually research using nerve conduction testing that was finding the same thing. So when you consider that the nerve degeneration that happens in PN is thought to be irreversible, having multiple studies showing acupuncture improving nerve conduction is really a special thing for us in this practice. It means that a case can be made that acupuncture should be considered a first-line treatment, not just as some viable alternative that can be tried when the mainstream treatments aren't working. Most of the strongest research we have on acupuncture relies on subjective measures like visual analog scales, measuring your pain subjectively from 1 to 10 or things like that. And then, of course, acupuncture critics will bring up the placebo effect to explain these kind of reports of subjective improvements. But to have multiple outcome studies using equipment-based measurements, objective equipment-based measurements like nerve conduction testing, showing acupuncture routinely causing improvement in nerve conduction, that puts this research in a very unique light compared to most acupuncture research. There's some other equipment-based ones out there, but not very many. I also realized that another important set of questions was being investigated in acupuncture PN research. So many successful studies have been carried out that some researchers started to do reviews of these studies to see what acupuncture points were being most commonly used in these studies. And there was a great deal of overlap. So in other words, there was a type of consensus that was buried in this research about what acupuncture points get the best results. And although it was a lot of work, it was actually kind of fun to dig this out of the research. It was also personally validating when I realized that the points that I had found myself, basically mainly by intuitive feel, that the points that I had in my treatment protocol were among those points on those list of the most frequently used points in successful acupuncture research. Now, there's also some degree of consensus, not as well teased out, but still further, much more than we unfortunately usually get in acupuncture research, about what I believe is probably an even more important topic than the best points, and that is the treatment dosage. So there was a kind of standard for treatment dosage that was set in some research nearly 20 years ago, and other researchers began to follow that. And when they did follow it, they got better results than the ones who didn't follow that dosage. So in total, this body of research gives us the opportunity to make the case that acupuncture has the potential to reverse the irreversible nerve damage found in peripheral neuropathy, that we have evidence-based data on which points work best and at which dosage. So this unique combination of pieces of the puzzle forms the heart of the Acupuncture Now Foundation's PN campaign. We're trying to rally support around the case that acupuncture should be seen as a frontline first choice treatment for PN. The ANF's Vice President of Research, John McDonald, and I spent nearly a year compiling dozens and dozens of published trials on acupuncture treating PN and actually reading them. And so what started off as a brief review that I was going to throw together for my first PN course morphed into the most intensive review of research on a single topic of acupuncture that I've ever been involved in. And I've actually been involved in a few pretty extensive reviews. John and I put all this research together and we wrote a narrative description explaining how to understand this research, including showing why the few negative outcome studies were almost certainly negative because of poor clinical outcomes. They didn't follow the points or the dosages they should have. We sent this information, which was 72 full copies of full studies, to the U.S. Center for Medicare and Medicaid Services, requesting that they review this research and approve the coverage for acupuncture for PN under the U.S. Medicare National Insurance System. That's the national medical insurance system providing insurance for 62 million Americans 65 years of age or older. We published this submission on the ANF website and believe that this information can make a powerful case for insurance coverage for acupuncture for PN with other policymakers. So we want to work with those that can help get this information to policymakers because we think we have a good case to be made there. Now, here I show a copy of a directory that we've developed that is on the Acupuncture Now Foundation website. This is a directory of people that are trained in my PN protocol. This is one copy. This is the current directory. This is actually, we're having to redo the directory. We're having to we're going to redo the whole ANF website. We have to get it on a better platform that can better manage this directory. This is what the directory is going to look like. Part of our campaign is we are doing things. We have a Google grant, which gives us $10,000 US a month that we can run in free Google ads. And we're using that to drive people to the ANF website where they can find this directory and then find acupuncturists that are trained in evidence-based protocol for treating PN. All of those who take my workshop in May will be offered the opportunity to opt into this directory. Now, as I thought about giving this talk and trying to come up with a good example about how treating the elderly can be such a great way to not only help those who badly need our natural, gentle, healing services, but also as a way to grow and sustain a practice, I thought of one of my dear patients named Helen. Helen came to see me in my second year of practice, having been referred to me by one of my previous patients from an elder care facility. Helen was in her mid-60s and was told she had bone-on-bone osteoarthritis in her left knee, and she needed to have knee joint replacement surgery. But Helen had some other health issues that needed attention before she could be cleared to be able to have the surgery. She came to me in the hopes that I could give her some temporary pain relief while she waited to have the knee replacement surgery. I was able to help relieve her knee pain, but also able to help the other health issues she had that was preventing her from being able to take the surgery. However, by the time she was cleared for the surgery, she had no knee pain for several weeks. So we discussed this, and she decided to hold off and just kind of wait and see how her knee did. And as long as she wasn't having any pain, why have the surgery? If the pain got too bad, she would then have the surgery. So I ended up seeing Helen on and off for over 30 years until she was well into her 90s, and she never ended up having that knee replacement surgery. Now, here is a picture of Helen. The bigger picture is a picture of Helen and her sister, her little sister, when Helen was in her 80s, walking to my office for a treatment. Helen lived by herself in a little house about half a mile or 800 meters from my office. And she would walk there in her later years once a week. Every Friday, she would walk to my office for treatment. She was well known to the people in our town because she would walk to church, she would walk to the market, she would walk around this area of our town, and pretty much every day. Now, the smaller photo in the upper left corner, I just wanted to show you. This was actually the picture when I was getting ready to teach a course on geriatrics. I asked Helen if she would mind if we took a photograph of her and her sister, so I could use it in my PowerPoint presentation that I was putting together for this training. And so that upper left corner is actually the clothes that she was wearing, knowing that we were going to take a picture. The bigger picture is, so in other words, the upper left-hand corner was her picture-taking clothes. What she was wearing here in the bigger picture is what her walking clothes that she normally wore. And I just thought that was the sweetest thing. So I wanted to show you both photos. When Helen was 89, she fell while walking to her local market doing some grocery shopping and fractured her right femur and right clavicle or collarbone. That combination at that advanced age can be very serious, as the inability to hold the walker because of the clavicle fracture can complicate recovery from the hip joint replacement surgery. The immobility caused by a hip fracture itself in this age group can lead to complications like pneumonia that can even prove fatal. In Helen's case, her family insisted that I be allowed to visit her in the care facility she was recovering from her surgery from, so I could give her acupuncture treatments. We had to get clearance and everything, but her family really pushed the administration there. She was able to make a complete recovery and even to resume her outdoor walks until her early 90s. Her family eventually made the difficult decision to that Helen could no longer live alone, and they placed her in one of those local elder care facilities some of my first patients came from. And I was able to continue to visit and provide treatment to Helen until she passed away at age 96. Over the roughly 30 years I treated Helen, she referred dozens and dozens of patients to me, including family members and actually some of the pillars of our community. So it's now been more than 10 years since I've taught on geriatrics. And the first time I've done so now being a member of this patient demographic myself. So this has allowed me to reflect on many aspects of my services to that age group. One way treating so many older people has informed and inspired my life is to observe how the inevitable decline that comes to all of us, fortunate enough to live long enough to experience that inevitable decline, just what we'll face. And you also learn something by seeing the impact of how lifestyle choices we make in our early years will either reap us benefits in our later years or become a price we must pay in the final phases of our life. And that's another blessing I've been able to experience. It's often said you can tell a lot about a society by how they treat their elders. While the many advancements of our modern societies have allowed so many to live to an older age than was the case for their grandparents, it has also left many of our older adults in desperate need of the gentle, natural care we can offer with acupuncture and Chinese medicine. So I hope you found this interest of subject and that you will consider doing what you can to provide your much needed services to our fellow elder beings. And thank you all so much. We're going to take questions. I did want to share something about my book, Making Acupuncture Pay, because it had been out of print for quite a while because the company I used to self-publish this book went out of business. But we just got it back for sale. So this is a new copy of the cover. This is actually the cover I wanted from the beginning, but I couldn't make this happen 15 years ago. But with AI, we're able to make it happen now. So I wanted to offer all of you attending here a discount code where you can purchase this on Amazon as a Kindle or a paperback now. But it's also available at makingacupuncturepay.com as a PDF, a downloadable PDF. We were going to give a discount code, but it just didn't have enough time to figure that out. But my email address, matthewbauerlac@gmail.com. You can email me with any questions, or once we get the discount code going, I'll be happy to send that to you. Otherwise, you can see that at makingacupuncturepay.com. And thank you all again. Please, any kind of questions, I'll be more than happy to answer.
Thanks, Matthew. So yeah, if anyone has any questions, please feel free to chime in, or you can post them in the chat box here. Give you a few minutes to have a think if there's anything you want to ask Matthew about treating peripheral neuropathy, geriatrics, or anything else. I actually had a bit of a question. I was curious to know how your Taoist training has influenced your practice, because it sounds like you're quite kind of mindful of research and like modern evidence, but then there's
Right.
also this piece of the traditional Taoism. So I was just curious how those two worlds come together for you.
Well, my Taoist background was huge in every aspect of my practice, because I actually learned that these concepts of qi, yin yang, five elements, all this sort of thing, it was not unique to Chinese medicine. It's like the basic of Taoist science. So just like we in modern science, we have the atom theory that leads to things like, uh, the development of drugs and all sorts of things. In Taoist, we've got qi science. Taoism, we've got qi science that leads to all other things. But particularly what happened to me, which I really just only recently, for the first time, I did a seminar with healthy. I did a talk with Healthy Seminars where I actually shared for the first time publicly what happened to me, and that was I was doing qigong in addition to my Taoist master, I studied with a qigong master, and it's something I hope to get out again, maybe on another website or something. But I had this energy come to me that really opened up my qi blockages and made me extremely sensitive to chi blockages, uh, remarkably so. So I actually became a intuitive acupuncturist. So I find points by feel, by intuitive feel. That's why over my career, I haven't really taught courses on how to find points the way I do, because I can't really teach that. But what I did just recently come to realize, and it happened with peripheral neuropathy, was that with peripheral neuropathy, I kept finding the same points on 90+% of my patients. So I actually tried an experiment with peripheral neuropathy, and that was to just use the same points on everybody and not trust, and not, it's not so much not trust, but not lean on my ability to scan patients and find points by feel. And when I did that, I was really happy with the outcomes. Now, with the hands for the chemotherapy patients, I always find more points by feel than I really want a needle. So it took me a little while of choosing between different points I was finding before I developed that protocol. But all the points I want to teach in my geriatrics course coming up in May here on things like macular degeneration, urinary incontinence, compression fractures, and things like that. These are points that I actually found by intuitive feel, and that ability to open up my own chi system to where I could have this kind of breakthrough that allowed me to feel chi blockages. That is when I told my Taoist teacher about it, he said, yes, that's a very important breakthrough for you. It's happened to people throughout time. That's actually how some of the acupuncture points were discovered. But he told me, he said, don't tell other acupuncturists about it, because they either won't believe you and think you're lying to make yourself into some kind of phony master, or they will believe you and be jealous of you. So that's why I hadn't said anything for 35 years until recently. So now I'm coming out of the closet about this, and trying to share with people what especially point combinations that I've learned through intuitive acupuncture for so many years.
That's amazing. Thank you for sharing that, Matthew. We've just got a question from Jennifer here. When you travel to give acupuncture treatments to the elderly in care homes, do you have any particular issues or challenges compared to when you're just treating within your clinic?
The number one challenge is usually getting okay from the administration to be able to do that. So, some places it's almost like don't ask, don't tell sort of thing. They let you in and they just, don't want to know about it. But in other places, there might be some extensive sign off that has to happen because they're worried liability wise. The only other issue is, depending, I mean, and this would be true for if an acupuncturist working in a hospital or something too. I mean, if a patient has, you know, IV lines and very much, equipment, connected to them, yeah, you could be really limited in the points you can get to. But generally, just like I found with my first geriatric patients, again, often, we're not going to make a world of difference, but every little bit of difference there makes a disproportionately large quality of life difference. So I wish it was more common for those of us to get into these kind of facilities. But I know it's going to be hit and miss about who can get into any kind of facility.
Great. Thank you. Just got a couple more other little questions coming through, Matthew, if you've still got some time.
Yes.
We've got one here from Fred. Do you have patients with nerve damage due to stroke?
Yes, of course, but that's nerve damage in a different way. In a stroke, it's from central nervous system. In the peripheral neuropathy, it's local nerve damage from the local peripheral nerves. And that's why using local acupuncture points works so well. And actually, some of what I saw in the literature and in the research, um, you know, points that might work for like paralysis from a stroke don't often work that well for peripheral neuropathy, and and also points that might work like in diabetic peripheral neuropathy, points that might help the diabetes, which is of course a good thing, actually don't work very well for the damage done to the nerves. There, the nerve damage is done locally. It's almost like an injury, like a burn. And with stroke, it's coming from a different source and different techniques. Now, I still use local points for stroke patients, but you really need to combine that with things like even scalp acupuncture and all that can really help for stroke victims.
Right. That makes sense. Another question from Livia. Any problems with needling diabetic feet, like for example, the risk of infections?
Yeah, no, as long as you're doing clean technique. I mean, the much bigger risk for diabetics is that they don't get this kind of treatment. I didn't have to show you here, but I have a slide, some photos of a patient, and this was another one where the family had to insist that I get in to treat somebody in a hospice where a diabetic patient that had developed gangrene on her heel simply because she had neuropathy and could not feel anything. She was in a care facility where they weren't checking her closely enough and moving her enough. So she developed a little ulcer from a pressure sore on her heel. And because the circulation was so bad, that turned gangrene. And uh, and she ended up in hospice. They didn't even want to try to do the debridement surgery to cut out the gangrene because her circulation was so poor. They were sure she couldn't recover. And then she developed another ulcer a few inches up on her ankle around the spleen 6 point. So the family called me in, and I, of course, told them, look, I'll do my best. We might be able to get that ulcer cleared up, but, it's too far gone on the gangrene. But I went ahead and treated around the gangrene anyway, and the ulcer cleared up within a couple weeks. But what was amazing and what happened there, and thank goodness they had observant wound care people, was that the wound care nurse noticed that the skin, the flesh around the gangrene had went from, a pale pasty color to brighter red. So it was obvious that there was way more blood flow coming up to the gangrene. So they decided to go ahead and do the debridement surgery and scoop out all of that gangrene material and sew her back up. And she recovered from that, and she eventually got checked out of hospice. And the wound care people said it had to have been the acupuncture that did it. So yes, there is some risk, And of course, if anything was to happen with a diabetic developing something, you have to be careful. But again, my belief is that even in my father's case, who couldn't feel any needles at all, pretty advanced, that acupuncture is a very positive thing for these types of patients, and it should get recognized as such, and it should get recognized in wound care as well. This peripheral neuropathy training that I do is almost like wound care, and because now the wounds are under the flesh in the peripheral nerves, but it's a similar concept. And the fact that this treatment can do what no other treatment can do in sparking the body's ability to get the upper hand on what it has been losing the upper hand on, that is so important. And it doesn't mean we have zero risk, but here I'm sure that the benefits far outweigh the risk.
Thank you. That's such a testament to how powerful acupuncture can be for those kind of conditions. That's amazing. Are you okay for time if we've got a couple
Yeah,
of
absolutely. Yeah,
Great.
absolutely.
So just from Jason, he's just wondering if these kind of protocols would also be effective for things like idiopathic cold feet, like Raynaud's. And then another question from Livia, do you also use herbs alongside the acupuncture for these kinds of things?
Well, with Raynaud's, I would certainly use these kind of points. But one of the things that I teach in my PN course is to say, look, when it comes to peripheral neuropathy itself, and something that this is me quoting what I consider to be the best researchers on acupuncture for peripheral neuropathy, led by this German neurologist. And they say the nerve damage in PN only happens two ways. It's either to the myelin sheaths or the axons. And the doing local acupuncture points for this, it works for both. And that is the main, should be the main thrust of the treatment. But when it comes to something like, even like I was saying in diabetes or something like Raynaud's, I would say these kind of points will probably help the local circulation, but you should also there be looking for using TCM type of diagnosis about underlying, yin-yang imbalances to supplement that kind of treatment. And as far as the herbs go, yes, in different ways. Like, for example, that wound care patient with the ulcer, I use Yunnan Payao and watermelon frost. Those are two patent herbs. Now, Yunnan Payao is supposed to be about stopping bleeding, but it actually helps healing. And watermelon frost is incredibly powerful antibiotic and antiviral that can be used topically. So if there's something like an ulcer like that, I'll definitely look to use those topical herbs. As far as the kind of internal herbs go, I played with some formulas, and I'm sorry, I don't know the Chinese names, but one formula I used to use that I know is used for improving circulation in the legs is called Stephiana and astragalus combination. And I don't know what the Chinese name for that is. And I use that, but mainly I use that for circulation. That's usually circulation leading to edema. And that's a formula that I've worked with, but I really haven't employed that or any other formula internally for my peripheral neuropathy patients.
Thank you. Couple of last questions here as well. So someone's just asking, Darren's just asking, what are some of the common points that you're using for diabetic-related peripheral neuropathy in the aged? I guess if you're willing to share some of the common points. And then also, do you use Moxa in combination with your acupuncture from Jennifer?
Yeah, great. I would say I I don't use Moxa myself because I'm in Southern California, and I believe Moxa is the most powerful for combating invasion of cold, and I just don't see hardly any of it. And I made the decision in about my third or fourth year. I did use Moxa on and off, and I had some great teachers, by the way, that were amazing at using even direct Moxa. But I made the decision that I didn't want to be inhaling Moxa fumes my career. Even with smokeless Moxa, it puts out some nasty fumes. So I just decided the combination of being in a warm climate, not hardly ever seeing cold invasion patients, and the odors that I wouldn't use that. But I would be when I ask about diabetes, I would be careful about using. I would be careful about burns with diabetic patients. So I would be careful about using Moxa there. And as far as the points go, yeah, I definitely like to teach way more kind of advance every aspect of the whole treatment process. But I'll be happy to share with you the the studies that were done that showed the most frequently used points for uh, for in successful acupuncture research on peripheral neuropathy for the lower extremities were large intestine, oh, excuse me, were liver 3, uh, spleen 6, and stomach 36. And those 3 points are definitely in my protocol. I had 2 more points with my protocol, and a lot more information about how to stimulate, how to space the treatments, everything else about the whole treatment process. But liver 3, spleen 6, stomach 36, that is on more than one review of the most commonly used points for peripheral neuropathy, at least for the lower extremities.
Right. Thank you so much, Matthew. Looks like that's all of the questions and everything we have for today. That was yeah, really, really good discussion. Thanks everyone for putting in the questions, and thank you, Matthew, for a great presentation. So just a reminder, we're going to be hosting Matthew here in Sydney, Saturday the 17th of May to Sunday the 18th of May, where he'll be covering treating peripheral neuropathy and geriatrics with acupuncture. So we're very much looking forward to having Matthew out. If anyone's interested in joining us for that, I've popped the link in the chat, and we'll send out an email with the information there. But I hope everyone enjoys the rest of their Tuesday, and thank you very much again, Matthew. We'll talk to you again soon.
Thank you.